It is every surgeon's worst nightmare, a broken hand. But what if I were to tell you there's a new cutting-edge procedure that helps those who help others get back in the game a whole lot quicker?
Good to see ya again. So, what can I do for you today, Renee?
Dr. Victoria Givens takes great pride in her work as an Austin-based plastic surgeon.
I really like the artistry behind it, especially the aging face. I like restoring it to youth and making people feel more confident about themselves.
3 months ago, a freak accident to the metacarpal bones in her operating hand
I jumped up, this came flying back, and I was holding and it smashed me right here.
left the medical professional in potential career peril.
It was clicking when I would press it that something was probably very wrong, and then basically my job flashed before my eyes.
A crucial search for a speedy recovery landed Givens at Texas Orthopedics, where Dr. Jason Somogyi
How's everything going with that hand?
had been using a new fracture fixation procedure, quickly gaining traction in Texas.
Think that if you're not doing this, you're giving the patients a disservice. Now, there's times when other things need to be done for specific circumstances, but the OR time, which is decreased, the recovery time, which is decreased, the stability and the healing of the fracture, which are all increased, all these things have been a huge change since my start of practice.
Using a nail designed to fit accurately in the metacarpal canal.
Screws growing across that, holding that fracture in place as it goes down to stabilize the bone.
The minimally invasive approach not only kept Dr. Givens out of an 8-week cast, but back to operating in around 3 weeks.
It's been amazing for someone in my specialty where I depend on finesse and dexterity.
Covered by most health insurance providers, Dr. Somogyi has operated on 40 patients in around 18 months.
Screws are in excellent position, your alignment looks perfect.
And expects that number to continue to grow with its high success rate.
Little tiny incision that's about 1 centimeter large, and they can't imagine that stability is giving them the activities that fast.